I want to just, maybe this is a good moment to debunk this argument, this so-called argument that the Republicans have been putting out there. They're sort of desperately trying to figure out how to blame us when they're in charge of everything for what's about to happen. So what they're saying is that we're fighting to preserve, we're fighting because we want to make sure that their term, illegal aliens, get health insurance. So I just want to be clear, okay, that's a lie. They do not want to talk about how they are raising healthcare costs for people, taking away people's health insurance, and so they are trying to change the subject. It is against the law right now for a person who is an undocumented person to get Medicare, to get Medicaid, to buy their health insurance on the health insurance exchanges in your state or nationally. So this is a classic trying to change the subject, trying to scare people. It is not true, and we should just be really clear about that as we think about what is really at stake in this moment, which is whether you are going to be ending up paying 75% more for your health insurance premiums because Republicans refuse to work with us to solve that problem.
I also want to be really clear about something too, and I looked it up. The Medicaid program in Vermont is actually called Dr. Dinosaur.
You doubted us?
I doubted. It sounded ridiculous. That sounded ridiculous.
We
That sounded ridiculous, Bernie.
That
didn't sound right.
ridiculous. You should have
Yeah.
known.
It makes medical assistance in Minnesota sound sort of, I don't know, Minnesota nice.
So I want to go back to Tina's though. Tina, tell us again, exactly how many undocumented people living in the United States have access to Medicaid?
0 people. 0 people.
Well, that's a problem.
But that's the whole, we just have to keep saying this enough because this is the whole idea. They want to treat it as if it's a scam. And this is health insurance for your grandma.
That's right.
This is health insurance for your neighbor. This is health insurance for that baby with multiple medical problems.
And I just want to reiterate a point that Senator Welch made. The system is already broken.
That's right.
Okay? We did, the ranking member of the Health Committee, Health, Education, Labor, and we looked at nursing homes. Oh my God. It is that we treat the elderly and the disabled the way we do. Never forget, I was at a meeting in Burlington, Peter. Guy gets up, town meeting, he said, I got to tell you something. Close person to me said, if you send me back to that nursing home again, before you do that, kill me. I will not, I cannot deal with that.
Terrible.
These nursing homes all over the country are understaffed, food is inadequate, etc. And let's be clear, when you cut Medicaid, what was the number, Peter, that you quoted a moment ago? What percentage of, what's 2/3 of funding for nursing homes come from Medicaid?
Yeah.
I've long been, along with everybody here, an advocate for community health centers because we think primary care is enormously important. Everybody should be able to come to a doctor. Be devastating for community health centers. Make it harder for you to walk into a community health center. And to pick up on Tina's point, what demagogues always do is try to change the subject and blame a powerless minority.
That's right.
Okay, you can't afford housing, you can't afford healthcare. You know who it is? It's the transgender community. You didn't know that, but that's who it really is. And you can't afford healthcare. We're trying to save you money by getting those illegal people off of Medicaid. It's a lie. What they don't want to acknowledge is what many people here have just said. Simple reality. $1 trillion in tax breaks to the richest people, 1%, who have never ever had it so good, and you pay for that by cutting Medicaid and making it harder for people to pay for the Affordable Care Act.